My name is Jane Deal. I'm a paediatric nephrologist with an interest in hypertension in children and adolescents. Hypertension in the young is still relatively rare, but is important for the individual child, but perhaps more importantly for the future adult. We are seeing an increase in hypertension in the young, mainly associated with the increasing levels of obesity, and as a result there's a time bomb in this country and the Western world that's going to lead to substantially increased prevalences of hypertension, both while they're young and as adults. It's complicated in the young. The origins of hypertension date from fetal life and are there in childhood, and we need to be doing something about it. It used to be said that the majority of cases in the young was due to secondary hypertension, and therefore it's important that investigations thoroughly look into the underlying cause, and then treatment is guided by what is found. But increasingly we're now finding that primary hypertension is much commoner than used to occur, and the interventions for that are more contentious and perhaps more importantly very tricky to institute. Because of the association between hypertension and obesity, it's going to be extremely important to tackle the epidemic that we're seeing, particularly with non-pharmacological measures, weight reduction, salt reduction, increased exercise, and avoiding other risk factors such as smoking. But these are also the areas that are most difficult to have an impact, particularly in the young who are notoriously resistant to the measures that are introduced. In terms of what a GP should know about hypertension in children is they should know that it exists, it's silent, therefore if you don't look for it you won't find it. Conversely, screening probably has no place because we don't know what the long-term benefit of screening is yet, and most of the studies show that it hasn't got a place. GPs need to know how to measure blood pressure in the young, and that relies on having the right equipment and the knowledge of what is normal, which means getting out the centile charts that have been derived so that the measured blood pressure can be compared, knowing the age, sex, height of the child that's being measured. Having the right equipment is extremely important. Many of the machines that are out there and available are not validated for use in children. And so it's very important to check, particularly on the BIHS website, to make sure that any machinery that is being bought is appropriate for use in children. Having the right size cuffs is extremely important, and having the right environment and the time to be able to measure the blood pressure in a relaxed, non-stressful situation is very important. What should a secondary care physician know? Well, really much the same. The importance of measuring blood pressure in the young, getting sensible readings, taking note of those readings, and having some understanding of the underlying epidemiology and investigating the young accordingly.